Hello, my name is Katie Fryman, and this is my project proposal to increase smoking cessation via combination nicotine replacement therapy and telephone counseling. Every year, approximately 480,000 people die from smoking in the United States, making it the leading cause of preventable death. According to the CDC, 7 in 10 smokers wish to quit smoking, and 4 in 10 have tried at least once in the last year but were unsuccessful. A combination of nicotine replacement therapy and telephone counseling could be just what they need to quit. Telephone counseling is available 24/7 and is free of charge. The counselors are there to offer advice and support on an individualized level. Before this project proposal, a literature review was done, and I will discuss a couple of the studies that showed improvements in smoking cessation rates when telephone counseling was combined with nicotine replacement therapy. The first study was done on patients who had elected to undergo surgery. 4 weeks before their surgery date, they were split into 2 groups. One received standard care, which was physician advice to quit. The other group received nicotine replacement therapy and telephone counseling. The combination group had an increase in smoking cessation rates before surgery, 4 weeks after surgery, and a year after surgery, as well as a decrease in the number of postoperative complications. The second study split people into 2 different groups. One group received nicotine replacement therapy alone, and the other received the combination nicotine replacement therapy and telephone counseling. The combination group had a 6.5% increase in smoking cessation rates than those that did nicotine replacement therapy alone. The purpose of this project is to increase smoking cessation rates by having primary care providers, whether it be nurse practitioners or doctors, speak with patients about telephone counseling, especially its benefits, with any routine doctor's visit. Recruitment for this project will take place at the University of Kentucky Internal Medicine Clinic. Patients will arrive for a previously scheduled appointment and be screened by a registered nurse who is part of the project for tobacco use. To be eligible, a patient has to be at least 18 years old and smoke 10 or more cigarettes a day for the last 3 months. If the patient is eligible, the primary care provider will see the patient as normal and talk to them about telephone counseling, especially its benefits, and about smoking cessation. If the patient agrees to make a quit attempt and is going to use some form of nicotine replacement therapy, the principal investigator will then see the patient and talk about the project. If the patient is agreeable to the project, consent will be signed. The patient will receive a follow-up call 1 week after the project starts. This call is simply to answer any questions that they may have regarding nicotine replacement therapy, the telephone counseling, or the project itself. No data will be collected at this time. Data will be collected at 3 months, 6 months, and 1 year after the project starts. This will be done by telephone with a structured questionnaire. The questionnaire will be questions directed at nicotine replacement therapy, telephone counseling, whether they used them and if they thought they were effective, the number of quit attempts that they made, and if they used the combination, if they thought it was beneficial, in addition to finding out if they did quit and for how long. Data will be presented in percentages. For example, 28% of those that used telephone counseling found it beneficial. A timeline is included on the poster for your reference. The overall outcome of the project is to see an increase in smoking cessation rates. If we can do that, and if we can decrease the number of adult smokers, then we can lower the healthcare costs and improve the overall health of the individual. For example, in just 12 hours, the level of carbon monoxide in the body goes back to normal, and in 1 year, the chance of coronary heart disease is cut in half of that of a smoker. Having primary care providers talk with their patients about telephone counseling should increase its use and therefore increase smoking cessation rates. Thank you for your time.